Long before the controversy over Obamacare's assault on religious liberty, Senator Roy Blunt introduced legislation to protect religious organizations from the government's overreach. Senator, thanks for joining us.
Hey, good to be with you, Rob.
You anticipated this problem last year. What prompted you to introduce your bill?
Well, for the first time with the President's health care bill, the government gets in a position where it's going to start mandating health care. You know, all the discussions about, well, the government's going to decide who your doctor is going to be and what medicine you can get and what procedure may be appropriate is, I think, the course that we're headed on unless we change course, and hopefully we change course on all fronts. But now we have health care mandates, just like for decades we've had employment mandates, and in those employment mandates, the law is full of exceptions for faith-based institutions. And now that we could have health care mandates for the first time, those faith-based institutions need those same exceptions, or they no longer will really reflect their faith-based view, their worldview, their unique distinctive that makes them different from just another hospital or just another senior facility or just another clinic. And it's important that they continue to have those protections.
You tried to offer an amendment in the Senate last week and weren't allowed. So what comes next?
Well, we need to get this legislation passed, and if it doesn't pass this year, if Obamacare still stands, we need to get it passed next year. Now, the better thing is just to move away from this whole idea that we can mandate health care coverage and health care decisions. There are better ways to reform the delivery system through more transparency and more competition, and lots of ways to look at better liability reform. There are lots of things you can do to make the current system work better. This doesn't do that, and the best thing to do is just to step back and say, we're headed in the wrong direction, we're not going to go there, and I hope that's what happens in 2013.
Last week, President Obama announced his accommodation. Now, Catholic bishops have come out against it, and you even called it just an accounting gimmick. What did you mean by that?
Well, I think it's exactly that. I mean, it's the more you look at it, if you want to find an excuse here, I suppose you could argue that we've now hidden the cost under a different shell. This is not about cost, it's about control. It's not about cost, it's about the Constitution. And if you can decide that, well, this no longer offends me because I don't have to pay for it, I guess your concern was financial all the time, not faith-based. This is not, and I think this is a genuine assault on First Amendment freedoms for not just the church or the synagogue or the mosque, but of all the institutions that are part of their overall societal outreach.
What would you say to those who view this as just a fight over contraception? How do you explain this to them?
I want to be sure that we've established the principle here that the Constitution establishes, that President Washington understood and President Jefferson understood, and my guess is that every president between them and right now understood, and that is that respect for conscience is respect for religious freedom. When you begin to believe that the federal government can decide what kind of care is offered, what should be, what is available to you, how it's offered, you've really fundamentally changed the relationship between government and the people that are supposed to be the ones that the government works for.